kidney stones, the mere mention of that can make you wince. If you've experienced the excruciating pains of kidney stones, you'll know it's something that you basically never want to happen again. But what if I told you that you can significantly reduce your risk of going through this excruciating pain again? And you can do so naturally. Kidney stones are quite common. About 1 in 10 people will have them during their lifetime, and they can strike anyone at any age, any background. The good news is there are some simple, natural steps that you can take to prevent those kidney stones or reduce their occurrence. And today we're going to look at 4 powerful research-based strategies to keep these stones at bay. Hello and welcome. My name is Dr. Terranella, and this channel is dedicated to helping you improve and optimize your health using my 15 plus years of experience, plus some medical research. Today, we're going to look at this and help you understand 4 main ways of preventing or reducing kidney stones. If you're finding this information useful and helpful, click that like and subscribe button to continue getting videos like this. So kidney stones form when certain substances in your urine, like calcium, oxalates, and uric acid, become increasingly concentrated. And it's when that concentration reaches a certain threshold, these substances will start to crystallize or clump together, forming what we know as kidney stones. And it can range in size from little grains of rice to more large marble shapes. And as you may or may not know, these stones can cause excruciating pain as they travel through your urinary tract. Often you'll have nausea, maybe even vomiting, blood in your urine, abdominal pain, and various symptoms. So they obviously cause a lot of pain, but they also pose a real threat to your health as well, especially when they're more severe and reoccurrent in nature. They can lead to things like urinary tract infections and even cause severe blockages in the urinary tract that can lead to acute kidney damage. So preventing kidney stones help you get out of pain and reduce that pain, but it's more about guarding against your long-term kidney health as well, and how the physiology of your body is working and trying to tweak and optimize that. And so before we get into how to go about that, I wanted to lay out some of the reasons this happens. And first thing to consider with this is just how the kidneys actually work to begin with. And so your kidneys are basically a sophisticated filtration and collecting system that are constantly working to remove waste and reabsorb water from any of that waste tissue. So your body's trying to pull that water and hold onto it and put it back into your blood. And when the filters become clogged up with these minerals or salt deposits or stones, their ability to do this filtration process is definitely compromised. And sometimes they block the actual tube, leading to back pressure up into the kidneys where they can potentially damage the kidneys. And this is known as hydronephrosis. And so the big obstacle with preventing kidney stones is really the lack of awareness. Many people mistakenly believe that kidney stone formation has to do with luck, or they have no control over it. And so the main obstacles is just the awareness around what you can do and how we prevent these and how we can analyze them and understand what the best things are for you to do in your diet, lifestyle, etc. And along those lines too, many people don't realize that there's different kinds of stones, and the different kinds of stones are going to steer you in different directions in terms of what to do. And so it's important to understand that different stones, different treatment plan. Okay, so if you made it this far in the video, you're probably thinking, all right, just give me the kidney stone prevention strategies. So let's break down 4 ways to prevent kidney stones naturally. So number 1 is hydration. So drinking plenty of fluids, especially water, is going to dilute that urine. And one thing you want to remember is anytime you have a salt or mineral solution, it has the potential to precipitate out, meaning form a stone or form a particle. And when we have more water, it's going to dilute the amount of mineral or particle that's in there. And so by reducing that concentration, it's less likely to precipitate out and create a stone or particle. So you want to aim for somewhere around 2 to 3 liters, and it is going to change based on your size and body weight, but about 8 to 12 cups per day. And of course, physical activity and hotter climates, if you simply are someone that sweats a lot more, you're going to have to shift your target for that water. And a lot of times, if you're finding yourself in the kidney stone category, you probably already know that you don't hydrate that well. And so you may want to bring a water bottle with you to just carry it along with you to help you remember to drink water on a regular basis. The second thing you're going to want to do is embrace the power of citric acid. So fruits and vegetables are definitely nutritious and we should eat them for lots of different reasons, but they also play a big role in kidney stone prevention, specifically those that are going to be higher in citric acid. The citric acid containing foods are going to bind to that calcium to prevent those calcium oxalate stones. The fruits that are higher in citric acid mean you're going to absorb more of that citric acid. And when that citric acid lands in the kidneys, it's going to bind to any calcium that's also in the urine and prevent it from creating the calcium oxalate stones. And so this is a strategy specifically for calcium oxalate. If you don't have calcium oxalate stones, it's probably not going to do a whole lot. So the fruits that generally have more of this citrate are going to be your citrus fruits like limes, oranges, grapefruits. Berries also have a fair amount, and melons as well. You can also take potassium citrate in the form of a supplement. You just need to be very careful about how much of that you're using. Too much can definitely cause a problem. So you want to run that by your doctor ahead of time. So one of the most common kinds of kidney stones are oxalate-based. And oxalates are naturally occurring compounds in many types of vegetables or plant foods. And in susceptible individuals, high oxalate intake can increase the amount of calcium oxalate stones that are being formed. High oxalate foods are often things that grow underground, so like beets and rhubarb and spinach and nuts as well have a lot of oxalates in them. Sodium is also a big driver here, so high sodium diet increases the amount of calcium that you're going to excrete from your tissues, and that's ultimately going to make its way into the kidneys, which can significantly raise your risk of developing calcium-based kidney stones. So you want to be careful about hidden sources of sodium. Again, this is where it helps to get the stones analyzed so you know which approach is going to be the most beneficial for you here. Ultimately, though, you're going to want to read labels and understand, am I getting 2,000 milligrams of sodium or more than that or less than that, and adjust accordingly based on what kind of stone you have. So again, the calcium oxalate stones are the most common, and there's also uric acid stones and struvate stones and even cysteine containing stones. Some of these are caused by genetic disorders, some of them are caused by infections. So because these foods are generally considered healthy and good for you, you wouldn't want to just cut them out completely, but you want to quantify how much of this you're having on a regular basis and try and basically reduce it. Also depends how aggressive you're forming stones, but you're probably going to want to use some moderation with the consumption of these kinds of foods. Also, if you combined the oxalate-rich foods with calcium, it's going to prevent the oxalate from absorbing into your blood and more likely to pass through your digestive tract without even getting into your blood, which then means it's not going to get into your kidneys. But knowing your stone type is going to help you navigate what you're actually going to do. And so you can basically, next time you pass a stone or feel like you're going to get some kind of screen and you're going to urinate into that so you can capture that stone. And then you send that into the lab and have it analyzed. Once you know which type of stone it is, then that's going to dictate which of these treatment strategies are going to work the best. Most of the time, they are calcium oxalate, and that is what most of the preventative strategies that I just laid out are going to work for. Making sure you're well hydrated is going to prevent most stone formation, so that particular tip is not specific to the type of kidney stone. So you might be wondering, this all sounds good, but is there any actual research on this, or am I just coming up with this? Well, actually, yes, there's definitely some research backing the effectiveness of these strategies. So let's take a look at some of those studies right now. So in the Journal of Urology, they looked at increasing fluid intakes and its impact on people that had reoccurring kidney stones. And they found basically that increasing fluid intake will significantly reduce the reoccurrence of kidney stones. The New England Journal of Medicine found that diets rich in fruits and vegetables, particularly those kinds of fruits and vegetables that we talked about that contain higher citrate, were associated with a lower risk of kidney stone formation. And studies have also confirmed that reducing oxalate intake or oxalate-rich foods can be beneficial for individuals with a history of calcium oxalate stones. And lastly, with sodium, this has also been linked with increased risk of kidney stones. The higher the sodium intake, the more likely you are to have more of those oxalate stones again. So these natural approaches that I laid out are not just random or old wives' tales. They're evidence-based strategies that can significantly reduce your risk of kidney stones. And these are the 4 types of things that I definitely recommend for my patients, as well as getting those stones evaluated to make sure the calcium oxalate before you implement these strategies. In terms of medications to be used for this, there's really not a lot of medications that are going to be used to help prevent these. But if you do have reoccurring stones and underlying conditions, sometimes medications can be helpful in helping the stone pass, or in some cases, prevention as well. So an alpha blocker is typically used for prostate issues, but alpha blockers can also help relax the muscles in the ureters where the kidney stone is passing. It's the tube that connects your kidneys to your bladder. And sometimes these can be used when stones are really large or there's difficulty passing those stones. In some cases, certain types of diuretics can also be used to reduce the calcium in the urine, so that you're less likely to produce those calcium oxalate stones as well. If you're someone that's producing more of the uric acid type of stone, perhaps allopurinol, which is a inhibitor of the enzyme that causes our bodies to make uric acid, can be useful in those cases. And as we mentioned earlier, the potassium citrate is something that's often used in people that have those calcium oxalate stones as well. By the way, if you're serious about taking control of your kidney health and optimizing your kidneys, you might want to check out our playlist on kidney health for more details about kidney function and kidney health. So now that we got some of these details hammered out, let's discuss the key takeaways on preventing kidney stones. So kidney stones are common and incredibly painful when they occur, but they are preventable, and some of these natural methods can be incredibly helpful at reducing the occurrence. So hydration is definitely one of the main things you're going to want to do. So drinking plenty of water is one of the most important things you can do to prevent these kidney stones to begin with, because that water is going to dilute the amount of mineral that's in your urination system and prevent the formation to begin with. When you're choosing a diet strategy, make sure you fill your plate with plenty of fruits that are of the citrate based, and specifically blueberries, oranges, anything that contains citric acid that we mentioned earlier are all going to be good choices. You should also be mindful of the amount of oxalate-rich foods. You may want to do a quick search on the types of foods that you eat and compare it to high-oxalate foods, low-oxalate foods. You may even want to consider taking those out of your diet completely, depending on how much you like them and how often you eat them. It's also a great idea to reduce your salt intake. Not always bad, but if you're chronically getting these stones, reducing the salt intake can be helpful, as we said. But you don't want to have no salt in your diet either. If you haven't had your kidney stones evaluated, it's a good idea to make sure you understand which type of stone it is, so that you know which strategies are going to actually prevent them from coming back. So one thing you always want to remember when you're thinking about kidney stones is the old saying that an ounce of prevention is worth a pound of cure. So hopefully this video gives you a better understanding on how to prevent those stones. But if you have questions, you can drop them in the comment section. And if you're looking for a more personalized, direct access, improve your health, or get you on the right track with your health journey, consider joining the membership program, where I'll have more time and attention to dedicate to your question. Now, one question you might have after watching this video is, how do I reverse or improve low kidney function? And you can find more information on that video right here. Thank you again for watching. We'll see you next time.